Hi, I'm Dr. Britton Bradberry here at Advanced Veterinary Care in Silver City, New Mexico. And today we're going to go through some simple passive range of motion drills for your dog who just had a cranial cruciate ligament surgery. This also works for medial luxating patella surgeries and even some hip surgeries as well. And our model for today is going to be our dog Caddy. Alright, so when we're performing passive range of motion, all we're really doing is trying to mimic natural movement. The concern that we have is atrophy here in these important muscles. We have the quadriceps, of course, the hamstrings in people, and so the incision is going to be here on certain surgeries, here on other surgeries. Unless you're just aggressively grabbing this area to hurt the dog, you can actually put your hand over the incision, or you can try to brace it as so. I prefer to go up, down, back, and forward. Now, the important thing is as you're coming back here, this is as far as this leg naturally goes. If I start pushing it back here, I start abducting the hip, and as you can see, even a normal healthy dog doesn't like that. So don't worry about pulling all the way back. If you ever have concern of how far you should go, do this on the healthy leg first before you do it on the surgical leg. But really, passive range of motion, in short, is going to be as simple as up, down, forward, back, up, down, forward, back. And you're going to do that probably about 10 to 15 times, a couple times a day. When we're focusing on hip surgeries, again, there'll be incision here. We're able to get a hold of this, and again, instead of doing the up, down, forward, back, I like to get a hold of the knee here because, again, we're having surgery on the hip, and I like to just do nice rotation, as if we're pedaling a bicycle. And each one of those revolutions are going to count as one. What you're going to want to do is 10 to 15 revolutions a couple times a day. So as you're doing these nice smooth revolutions here, you don't want to be rotating around like that. Keep everything in a parallel plane. And that's how we're going to deal with the hip. This is how we're going to deal with the knee. Thank you.